All right. Good evening, and welcome to World Without Rule of Law. Tonight, we're going to have a live chat, and the topic is going to be preparedness medical. So, talk about medical issues for a prepper group or a prepper scenario. With me tonight, I have a medical expert of sorts, and I won't try to explain her background, as I'm sure she could do a much better job of it than I could. I'm just going to introduce her, Miss Mary, a dear friend, a member of our church, and member of our group down in Virginia. And I'm going to turn the mic over to you, Miss Mary. Take it away.
Good evening, everyone. My name is Mary Hopkins. I have been a nurse for 40 years. I hate to say that, but that gives my age away. But anyway, I
You
am.
wear it well. You wear it well.
Thank you. Um, just to give you an idea of some of my background, I'm experienced, like hands on, as well as have been a director in the following areas, which is surgery, intensive care, cardiac, education, home health, skilled care, rehab, IV therapy, and administration. So I have had all of these experiences over the last 40 years, and it takes a lot of time to learn these things. But if you are a hands-on person, you can also be someone that can talk about these and bring something to the table when we need to discuss it. So I wanted to say that before we get started about the actually going into the medical piece, is that, as Tim mentioned, everybody has a gift and a talent that can be helpful when you begin this type of thing. So it's not just one person that takes the lead and runs it all. You have to work together to make it happen. So you may not have the experience in the medical field, but you can certainly be taught quickly to assist, for instance, if someone was hurt. So that would be some of the things that I would like to have people know, so that they can feel a little bit more comfortable about it if something does come up and they have to help someone out.
Yeah, I think we kind of touched on it. We had a stream a couple weeks ago talking about prepper, just community in general, and we kind of touched on like that versatility and skill building. Skills are always going to be the most important prep item in the most valuable tool in our toolbox, so to speak. And so certainly, we all can build general skills. And for instance, I know last year I took a basic first aid class. They offered it at the fire department. It was free, and it just was a quick overview and very, very basic. But as we progress, I want to try to build on that. And so I know that I'm never going to get to the point where I'm going to be the medical lead person in the group, but if I can just function as in an assistant capacity, or kind of just know my way around the basics to where I could stand beside you if there was a problem, and you could say, do this, do that, or set this splint, or whatever. Or as you mentioned when we were talking, we're not always going to be together, right? Something goes wrong when any one of us are on our own. It's going to be good to have that basic skill set, everybody. And so it's the same thing. Like for you, you can be the medical lead, but then on the other hand, it's nice if you know how to grow tomatoes too, right? So
Exactly.
we all kind of bleed over into other areas, and that strengthens the group as a whole also.
Yes, it does. And you were talking about being able to assist or help someone that might be the medical lead, but you really don't know where to start yourself. And we were talking earlier that you can get on YouTube, and there are videos there that you can get on for first aid. It will teach you some things. It's very simple, basic stuff, but you can get a lot of that information off of the internet. And the other thing is that you can buy books I don't know if everyone wants to collect books and put them in a library, but you can buy first aid books. You can get books on taking care of trauma, respiratory situations, indigestion. I mean, digestive problems. There's so many different things that we have to think about when you think medical. It's not necessarily just the fact that you might get cut or you might fall down and break a leg or something of that sort. Plus, you've got to think about your medications. What would you do for medicine? What would you do for the supplies that you need? So those are all the things that you could learn easily by even looking at the internet or reading books. So in my library, for instance, I have a first aid book, and it's not necessarily that I need it, but it's for my family as well, so that if they need to have something to look at and pull from, they can.
Yeah, that's a good point. You brought up medications. That was one of the things on my list I want to touch base on too. Was a lot of us, of course, as we get older and we're on different medications. I had open heart surgery a few years back. I take a maintenance drug for the rhythm or whatever. I'm not going to pretend to know exactly what it's for, but going forward, it would be nice to have a store of that medication. And a lot of times, it's difficult because the prescriptions, they'll refill them every 90 days. If I try to go in 80 days and have it refilled, they'll deny it. So I have to, I find it difficult to put back a storage of those, but I know from our preliminary talk, you've had a couple ideas on how that might be possible to do that.
Right. And this may not work for everyone, but I know with my pharmacy, for instance, I can go and get a medication, say 10 to 14 days in advance. And insurance may not cover their costs, but actually the pharmacy may go ahead and fill it for you and give you the cost that is your copay, so that you could have an extra supply. Now, they're not going to do this every time you turn around and every 3 months and you're going to have an extra, supply of medicine. But they may do it 2 to 3 times a year where you could put away the newer medication and use the older one up front.
Rotate them out, kind of.
Yeah, exactly. And there are some medicines that you can't really keep for a long period of time, such as nitroglycerin. Eye drops that are by prescription, those don't last very long, 30 days for some, maybe 60 days for others. But so you have to be careful in what you're trying to put away. But things like some of your indigestion medicine, some of your heart medications, pain medicine, if you're on maintenance for that kind of thing, you could easily put back some, but you won't be able to put back a year's supply.
Talked about, I know, people that have gone like down to Mexico and you can get some of this stuff without prescriptions, but that comes obviously with its own challenges too. Certain things, I guess, are trickier if you're trying to bring them back into the country or whatever. Linda, my wife, Linda, she's saying, books are always great. Never know when a blackout or power outage could happen. That's true, and that's an area that I have to focus on and look at because because I lack some organization sometimes, I find it easier to collect books electronically. Like I have a Kindle, I can read it on my phone, I can read it on my computer, and my eyes are getting bad. And, with that, I can zoom it way up so the letters are big. And I just enjoy reading in that way, or even audiobooks to a certain degree. And so as a matter of convenience, that's usually how I collect my books. But that's a good point because she brings up, because in some kind of grid down situation, or if we're in a situation where we don't have the way to power our laptops, that's a concern, right? We'd have to, the old, printed out paper books have value, but they come with a drawback too, because if you're on the move or if you have to move, it's a little bit more difficult to move a library with you.
Well, I have found that you may have to look at the subject matter that you've got collected and select some of the things that might come up that you're not familiar with. I
Mhm.
mean, in your family, you may have experienced someone that had an upset stomach, or say a temperature, or a sprain or a strain. You could pretty much think through those things, and you may not
Mhm.
need any books on that kind of stuff. But your more involved things, like a traumatic injury of some sort, a severe cut, a neck injury, those are things that you might want, or stroke, those are things that you might want to keep at your fingertips so that you be more
Mhm.
familiar with them. And I wanted to say something about the medications. You can purchase antibiotics that are for fish, for instance, that are very much usable by the human, that you can actually take if you've got an infection going on. So you can buy those through Amazon. You can get them through some of the
Yeah,
pet
I've heard
stores.
that. There a lot of stuff is similar. You're talking about like antibiotics mostly, right?
Right. Yeah.
Yeah,
Yeah.
yeah. Talking about going back to the books and the reading materials, there are also ways, and it's a little bit off topic, but since we brought up the medical books, I just want to glance off it quickly. Um, to have a plan to have like a spare laptop and a hard drive and put it in a tech protect bag so that
Hmm.
it could be hardened off against maybe like an EMP or different situations like that, and store those materials on there on thumb drives. And if with a small solar fold out
Hmm.
solar panel, we can have a way to keep those things charged. If we can protect them like from like say an EMP or whatever, if that were to be the scenario, we would have to, of course, make sure they were protected against that, and then take them out later and still be able to use them that way. So there is some viability there, because I know your point, with referencing the materials, a lot of it you can think through, but then we're just looking at medical, and then there are
Hmm.
many other aspects of it that I think it's prudent to look into some kind of electronic file storage and how to
Right.
prepare and harden it off and keep it usable in a grid down or any kind of scenario like that too.
Well, you have to remember too that your lead person, the medical lead, may not always be with you. So
Yeah.
there may be another person that is in the group that could be taught to step in with some of those other issues that might come up medically, that might be with another group that could help out. So you always
That's
have to
true.
think about that. And then the other thing is you have to think in categories too. For instance, if you've got cardiac problems, what are some of the cardiac things you need to think about? If you've got seizures, what are the things I need to think about for seizures? Do I have my family prepared, or am I prepared to help someone else? The big thing is that you yourself cannot take on the responsibility for the entire group.
Mm-hmm.
That
That's a good
everybody
point.
has
Has
every
responsibility for their own, to know
right,
their own maladies and kind of care
exactly.
for them. That's a good point, right?
Yeah, you have to remember what you've got going on so that you could be free to help others. Because if you don't have yourself taken care of, it's not going to work otherwise.
Yeah. Yeah, that's a good point. Good point. Let's see what else we have here. So when we talk about a prepper community, and actually, friend Kevin, who's on here, had brought up, we talked about it last time, and he had asked a question, made me think. It was very thought provoking. What's the difference between a community and a network? Now, that's off topic. I don't want to kind of go down that rabbit hole now, but I just want to put it out there because I think at some point we're going to look at that in another segment. So kind of get people thinking about
Hmm.
that, a network, as opposed to a community. But in a prepper community, you know, there is medical is one of your main. It's going to be high priority of
Hmm.
importance to have some sort of medical plan. And so to have someone like you who has, a great deal of expertise in these areas, is very helpful. And then, and it's like with everything though, there has to be an expansion of that skill onto others. There has to be training. There has to be,
Absolutely.
none of us are going to live forever. None of us are, bulletproof, right? So,
That's right.
if, for instance, if I'm the only one who can make the pump work to get the water out of the ground, then that's well and good until the day I get shot or die of a heart attack or whatever. Then what does the group do? So there has to be, for each area of expertise, and in this case with you with the medical, a group should have a comprehensive plan on how to train others.
That's
And
right.
bring to that, and that's, not everybody is going to be able to rise to say your level of proficiency. I can't even watch when they take my blood. I can't even watch them put the needle in. So I'm obviously never going to train to be where you're at. But again, like we said before, I could do the basics. So part of that plan is maybe you having to recognize who has the ability and the capacity
Mhm.
to rise to that level, and who maybe doesn't, and use people in different areas as their strengths provide.
Well, that's very true. And one point I want to bring up is that why we have the capability of accessing things through the computers, that there are interactive videos that you can watch on the computer that teach you basic skills about, say, heart saving, CPR, about taking care of someone with major cuts, taking care of someone with that does have a seizure or heart attack or a stroke. So I would encourage you to watch some of those things. Like I say, the American Heart Association has a lot of stuff out there that you
Hmm.
can have access to.
That's interesting. I'd definitely be interested in doing that. I'd have to look around and see if, like, is there like a specific like website or like an institute that offers those things, or is each specialty would be its own? Like it would be multi sites to look for to find that
Well,
information.
I know the American Heart Association does have numerous avenues that you can go through to get those types of training. So it's not just teaching you CPR or advanced cardiac life support. They do have a very simple class on taking care of small injuries and those things. So and you may have to pay for it. There
Hmm.
might be some cost to that, but there are some things too, like I was telling you about YouTube, which is free. You don't have to pay for those things.
Hmm. Hmm. Kevin is chiming in. He's kind of reiterating what we were saying and expanding a little bit about, I'll read the comment. He's saying you also need to share your medical issues with your team. They can't help you if they don't know. Whenever I'm out training, my team knows what issues I have and
Mm-hmm.
where to find my meds, inhaler, for example. That's good. That's important. And that would be like, so in my case,
Mm-hmm.
I need a daily med for my heart.
Mm-hmm.
Then my group should know where I keep that, where it is. This is where I have it stored. It's probably got to be in a cool place, so it's not necessarily going to be out in the open. So if something does happen, then that's a good point. Like, share those things. Don't, a lot of times we tend to guard those in a functioning society anyway.
Right.
We tend to guard that stuff, but really in a preparedness setting or grid down or some kind of post event scenario, we're gonna, trust is a big issue and it's hard to establish. But when you have a group, you have to trust those people, and so bringing them into that circle, I guess, is important.
Mm-hmm.
And
It's
Jerry's
worth.
saying back on medication supplies, you don't have to go to the drugstore to get a lot of things you need. Dollar Tree, Dollar General, yeah, et cetera, are good places. That's a good point too. And so, maybe if I had to say I was building a supply and I was just starting out from scratch, what do you think would be like the 5 or the 10 basic things everybody should have in their supplies as far as like over the counter, besides the obvious, bacitracin and band-aids and gauze and stuff like that, but
Mm-hmm.
into like say the next layer, Could you offer any suggestions for that?
Well, you need to look at having some hydrogen peroxide, some alcohol, Hibiclens, which that's a brand name for a soap that's a cleanser for a wound. You may not have that on hand, so you may not have soap actually. So if you have something that would clean a wound, you need to have that available. Steri strips are things that most people don't think about, but they're the small strip that would pull a wound together if you don't have sutures. Ace bandages, those are things that you would want to consider. A cold pack, those little packs that you can squeeze and they bust open and then they're cool. So that would be for a good, for a sprain or for a strain. You mentioned the antibiotic ointment, disposable gloves. Those are some things that you want to think about. And, with all of this about the COVID virus, that has certainly brought some of this stuff to the forefront, that how quickly a pandemic or epidemic can occur and how unprepared we may be, that you can't wait for it to hit and then all of a sudden you start getting prepared.
Yeah.
You need to already think about it and start putting these things in place. But getting back to what you'd asked me, the non-allergic tape, there's such a thing that you can buy. So because some people may be allergic to the tape that's surgical tape or latex glove products. So those are some things that you would want to think about getting. There are some Telfa pads. They're non-stick pads so that if there was a cut, you certainly don't want the gauze to stick to it. You want to be able to have a pad that you can put on there that will not open that wound back up or pull even some of the skin up, loose. Some iodine would be good. So there's just
some great suggestions there. A few things that I hadn't thought of too. So it's a lot of basic stuff, but some great suggestions. Daniel's just joining us. He's saying prescription meds will be an issue after 3 months.
Mm-hmm.
That's kind of reiterating, I know Daniel just joined us, but we did talk about that, rotating those out and how to have a plan. That's tricky, but I think it can be done. Obtaining them to me seems like the bigger challenge. And then if we have the extra, then, rotating them out, coming up with a plan to rotate them wouldn't be hard, but I think obtaining them is the challenge.
Well, also, and I just thought of something, but several years ago when we were going to go on vacation, we were going to be running out of our meds. And so I went and talked to the pharmacist and they gave us extra supply and they gave us an extra 90 days or 60 days, whatever the prescription was for.
Mm-hmm.
And so we were able to get that. And then when it came time to fill the prescription again, they went ahead and automatically filled it. So we had that supply left over, because certainly we weren't going for 90 days. So
that's something that you may or may not be able to answer this. I suspect you probably will, but is that something that the doctor has discretion to kind of bend a little bit? Like, if I were to say, let's just say I were to talk to my doctor, and if he was of the mindset, of a preparedness mindset, could he, at his discretion, allow me to have an extra 90-day prescription of some of this stuff?
It would depend on what the medication was, but in some cases, I'm not going to say in all cases, but some of your, say your heart medications, for instance, your doctor would possibly be able to encourage you to go to the pharmacist and talk to them about getting yourself an extra supply. Now, if he wrote you an extra supply, it would be going beyond what most insurance companies would say is legitimate. 90 days is about as much as they want to go.
And so we kind of touched on it before too, but so let's take that one step further. If I was willing to pay for that supply out of my own pocket and not go through insurance, I guess what I'm asking kind of is the doctor doing anything unethical or illegal by allowing me to do that?
Well, no. I mean, if you go to your pharmacist and you ask them to fill your prescription, they say, "Well, your insurance is not going to pay for it." You can say to them, "That's okay. I'll go ahead and pay for it out of my pocket, but I really need to have some extra medicine."
Okay.
Um, Again, it's going to depend on what kind of medicine you're taking and
Sure. Like
what
they're
it's
not going to
for.
do that for Vicodin or whatever,
Oh
probably.
no, absolutely not.
I can't. I'm allergic to. I can't take any kind of pain meds anyway. I had spinal fusion. I was on over the counter ibuprofen 12
Mm.
hours later because I was throwing up from the whatever Tylox I think it was they gave me, which is
Oh my.
synthetic morphine or something. I don't know.
Mm.
But
Yeah.
I can't take any of that stuff. It just makes me throw up. So that's not a problem for me. But
Well, some people, and this is just something to think about, but if you are on a maintenance pain medicine that is rather strong, it may be a good idea to start thinking about, instead of taking your dose of 4 times a day, your pain medicine, maybe intermittently in between that, instead of taking your pill, take your pill in the morning, the next dose, take a Tylenol, and then the next dose, take another pain pill, instead of using
Mhm.
all of your pain medicine at one time.
And at the same
Um,
time, you're kind of weaning yourself off of it, or not off of it, but to a lesser degree.
exactly.
Daniel's bringing up a good point too. He says I get extra by asking the doctor due to the COVID issue, and so
Yeah.
that's I mean that seems very legitimate. Things
Yeah.
go south, we can't always get into the doctor. If these things are needed, it is good to have an extra supply. So that's something to
Absolutely.
think about.
Yep, absolutely. You can do that. And I know that doctors in our area are doing that because of the COVID virus.
Yeah. Okay.
Yeah. Yeah.
Huh. So now in a prepper, in a post event situation, of course, there's a myriad of conditions that could take place. Ideally, we'd still have electricity, so we would still have a way to pump water, and that would make sanitization relatively easy. But let's say we're in a situation where there isn't water or there isn't a way to pump water out of the well, and so we're using water more sparingly. How would we address that, the sanitary aspect of medical procedures? Like where do we set up? How do we set up? What measures do we take to make it as clean as we can if we don't have a unlimited supply of water, let's say, on hand?
Well, the one thing you got to remember is that you may have to use some water and you may have to boil it. It may have to come from a creek. You may have to be close to a stream of some sort where you could have access to that. Certainly, we would have the capability, I would hope, to start a small fire where we could go ahead and
Mhm.
boil some water.
Use
Um,
the rocket stove even would be good for that purpose.
Correct. And the other thing is that I've talked to some people and encouraged them to buy baby wipes. And you can take those and they can come in small packages. You can pour just a little bit of alcohol on those
Hmm.
and you can use those to clean wounds if you have to. If you have to wash yourself off, certainly don't want to put alcohol on it, but you could use the baby wipe to wipe
Mhm.
yourself off, just like we would use to take care of a child.
Sure. And when you buy those, they come packaged in plastic. You
That's
get the
right.
dispenser, you open them, put them in. How long, theoretically, how long would one of those packages store before they would dry out or become unusable for that purpose?
Well, some of that depends on where you put them. If you keep them out in the sunlight or where direct heat is, they're not going to last very long. They're going to start drying out, but what they'll do is start drying out from the top, where the one that's coming out of the box, for instance,
Mhm.
that part of it is dry, that's sticking out of the top, and then the bottom part is still a little bit damp. And you can always add a little bit of fluid to it to try to keep those.
Okay. And
So
so, like, if we could store them, like in a cellar or root cellar or whatever, where it's cooler and a little damper, then
right,
they'll
right,
last a little longer. So we can, I guess, a
right.
lot of it just comes down to common sense and um, think through some of these issues. But it's good thing to think about.
Well, the thing too about expiration dates, let's talk about that for a second, is that if you have medicines that are getting ready to expire, you can still use some of those medicines, your antibiotics, for instance. They may not be as potent, it may cut their potency in half,
Mhm.
but at least you would have something that was going to be for an infection that would be beneficial. So, you have to remember that kind of stuff. And then Tylenol, basic Tylenol, the same thing. They may have an expiration date on them, but they still will be good to use, but just not as potent as what you would like to have.
Yeah, good point. Right. It's not like it's good the day before and then it expires and the next day it's not good.
Right.
There's definitely a ramp down on that. So I guess how do you know exactly what it is or how long it is? Again, it depends on where it's stored, the viability of it. But I guess from using it, you if that's all you have, then you got to just try and hopefully, you've done whatever you can to extend the life of it as long as you can. And really, beyond that, what else can you do anyway?
If you look at some of the expiration dates, they'll say it's best used by or used before.
Mm-hmm.
So they give you a date where you're going to, best for you to use. But then after that, it's your choice as to whether or not you use it or want to get rid of it.
Mm-hmm. Yeah, it's interesting because, like, for the prescription meds, of course, we could always rotate them. But if we're trying to put back a lot of that over the counter stuff that we don't normally like,
Mm-hmm.
Ibiclens, for instance,
Right.
not something we normally use. So if I was to buy some of that and put it back, it's just going to sit in storage. Does that have a shelf life? What is that shelf life? When does the
Mm-hmm.
efficacy of it drop off? So those are all things that I don't know if there's really any clear answers, but certainly things we have to consider. Jerry's saying small amounts of bleach can be used to get water to a usable level. That's
Mm-hmm.
true, and I think there's a website somewhere that there's a formula. I was looking at it when I built my rain catchment system.
Mm-hmm.
You can add so many teaspoons per 10 gal or whatever
Right.
it is, and it'll make it drinkable
Yeah,
because you
exactly.
certainly don't want to put too much. So then there you go. That opens a whole other thing because then if you're storing bleach, how long does that last? How long before that starts to lose its efficacy? So like there's issues with that too. And then, but of course, with water, there's always boiling too, and we have a Berkey water filter which performs pretty well, and so we've got some extra filters stored up for that. And a set of filters will get you like 6,000 gallons. So if you have a couple extra sets of filters, you're good for a little while. If you're just using it for
Mm-hmm.
drinking water or for medical purposes, certainly you don't need to run it through the Berkey to shower with it. A little bleach or just boiling would be fine for that. I think. I know there's sanitary issues with showering. You don't want to shower with dirty water, but I don't think we need to bring it to the same level we need to do when we drink it. So
Right, exactly.
we're
Yeah.
having just want to have a few a few comments here. Kevin say, would that be the same for other expired products? For example, Quick Clot.
Well, um, I can't speak to that because I'm not real sure about the expiration date on that. So I don't know whether or not that would be good or not. But I do know that, for instance, my vet advised me to, if my dog, for instance, like you cut their toenails, and I'm just giving you an example, and you get into the quick, my vet said use flour instead of having to buy the clotting factor. And that way the flour works perfectly. Just put their paw into it.
Hmm.
So you could do the same thing with a wound,
Okay.
if you had to, if you didn't have the quick clot.
All right, great. And Tim Harvey must have just joined us. He says, "Hi, Tim and Mary. What is
Okay.
Mary's take on using fish antibiotics?" And so Tim, she did address that, and I'll let her tell us again. It's just a recap of it, but certainly it's a viable option.
Yes, exactly. You can purchase the fish antibiotics, and they are just as good as getting antibiotics from a pharmacy. Um, I've used them myself actually in the past, so
Hmm.
it's nothing wrong with them. you just you got to buy what you think you're going to need.
Absolutely. Sure. All right. Well, I think that's pretty much all that I had. I think we covered that and more. You brought up some good points too. Before we close out, Mary, do you have anything else you want to cover or go over or say to the viewers?
I just want to reiterate what I had mentioned earlier, is to think about what is going on in your own family and what you would have to really pay attention to when you became involved in the prepping situation and into the community, so that you're prepared to take care of your family. And you've got to think in just beyond that as well. It may not be that you've got cardiac issues, but you need to think about respiratory care. You need to think about your digestive care. You need to think about the injuries. Also, the type of medicine you're taking. What kind of symptoms would you have, and what would you need? You need a thermometer, what, that sort of stuff. Would you need suture? Would you need needles and thread and those things? And so those are some things that you need to think about.
Like each person has to take responsibility for their own situation. Yeah, that's a good point. And so, all right. Well, I think it's 8:36, so we're just a little over half an hour. I think we covered everything. And Mary, once again, I'd like to thank you for joining us. It certainly was very valuable having your input, and appreciate you coming on and joining me for the stream. We did have Bruce from Backwoods Law scheduled to join us as well. He's got a background in combat medicine. He had some technical issues, so he wasn't able to make it in, but we'll try to get them resolved for next time. I think at some point, we're going to get Kevin on here, and we're going to talk about that community and, the difference between community and network, and try to unpack that a little and look at that. And certainly, I think if we think about it and regroup from this video too, we can do another segment for sure, at least one more on medical, and try to get into a little more depth and some more specifics in some of these issues. There's a lot here to look at. And so again, I appreciate you coming on, Mary, and I look forward to having you back. We can unpeel the next layer, so to speak.
Thank you very much.
Thank you everybody for joining us. Appreciate it. Appreciate you all coming in and checking it out. I hope you all have a good evening. God bless you. Good night.
Good night.